Repetitive strain injury, or RSI. It's a term that's frequently used to describe injuries, but I had an interesting case in recently of a musician who had what I would call a classic repetitive strain injury, and I'd just like to describe some of those details to you so that you can recognize it if you happen to experience these type of symptoms. So RSI is a bit like the definition of whiplash. It describes the mechanics of an injury, of how it happens, but doesn't really tell us much else. But to me, there are sort of a whole collection of signs and symptoms which fit into the classic repetitive strain condition, and it is important to recognize what elements of these symptoms people have so that you can plan appropriate treatments accordingly. We used to see a lot of repetitive strain injury when I was based in the UK back 25, 30 years ago, and there were some major outbreaks of repetitive strain in London around in the early 1990s, and we were involved in trying to manage these cases, and there hadn't been a lot of experience with treating repetitive strain in the UK at that time. Australia had experienced it in the early 80s and Japan in the 70s, and it did seem to coincide with changes in work pattern and people who were spending prolonged periods of time in fixed positions, whether this was keyboard related in fields of technology or in musicians. They would be the two common sort of cohorts of people. But interesting enough, historically, if we look back at ancient times, the people who used to do transcriptions and the scribes who used to do continuous handwriting, they often reported repetitive strain type of injuries too. But it often gets labeled as a tendonitis or trigger points in muscles, and to understand how these symptoms occur, we need to understand what tissues are involved, how they get irritated, and what kind of symptoms they cause when they're problematic. So the simple answer to the question, what is RSI, is it's a combination of irritation of different tissues, usually in the upper limb, because if people are playing a guitar or working on keyboards or on their laptops, there's a combination of strains that are applied from the neck, the shoulder, the elbow, the wrist, and the hand. So there's a whole chain of tissues that are under repetitive load, often in fixed positions for long periods of time. And that's really is the initiating mechanism which starts to cause overuse. And that can simply start off as the muscles being a bit sore. So people find themselves pressing or rubbing on trigger points in muscles or trying to stretch them out, or if they've explored a little bit more, doing something like foam rolling. So that's often how it starts, and it may not be considered too serious. And that muscle issue can then start to involve the tendons. So the tendons is attached to the end of muscles, so you can start to get low-grade tendon irritation, classically in the elbow, as in a tennis elbow on the outer side, or a golfer's elbow on the inner side, tendonitis around the rotator cuff of the shoulder, and sometimes specifically in the wrist and hand. So there are sort of a number of key zones that we often see where there's tendon irritation. But the hallmark of repetitive strain injury, that it happens much more slowly and gradually, as opposed to, say, somebody who just went out to do some gardening at the weekend and triggered a tennis elbow, which is a much shorter history. And that's important to recognize, because it does appear that a condition which is much more slow in evolving tends, unfortunately, to be much slower to resolve. And repetitive strain overuse injuries definitely fit into that kind of a category. So we can have soreness from the muscles, soreness from the tendons. We can have soreness in the joints. So people either find in the neck or shoulder that their motion is restricted, or that the joints are jamming and locking, and they want to keep self-manipulating, which is fine. It's a good way to give temporary ease, but it usually doesn't address the problem. Again, in the wrist, if the wrist has been held in fixed positions, that's another scenario that can just end up with restrictions of wrist motion and irritation in that area. So when one clinically examines the joints along the chain of areas where the symptoms, you can see issues in that region. And last, but by no means least, is the nerve tissue. So people always think that nerve that nerve symptoms have to originate from the spine, and usually because the nerve is being compressed in the spine by a bulging disc or a piece of bone called an osteophyte. Nerves can be irritated anywhere along their path, and in the arm there are three main nerves that come off the neck: the radial nerve, the ulnar nerve, and the median nerve. And they can be irritated in the front of the soft tissues in the neck. So once they get out of the joints, they can get irritated there. They can get irritated behind the collarbone. They can get irritated in the front of the shoulder. So people who are spending periods of time hunched over a laptop, designers, graphic designers, people working on spreadsheets for long periods of time, they are classic candidates for this kind of a scenario. So the nerves can be irritated on the front of the shoulder, or if people are holding a fixed bent position in the elbow for long periods of time, the elbow can cause a pressure on the nerve, either on the front or the back, and that can cause problems, and likewise the angles on the wrist. So let's say the guitarist that we saw recently, he had a situation where his hand, his playing hand was hanging in a bent position over the edge of the guitar. So there was a lot of compression on the front of the wrist, and obviously then using the fingers and hands as well to play the strings. So every case has a different kind of mechanism, but there are some common elements to it. But it's really important to recognize when the nerves are sensitive, because that's really a game changer. That changes the whole management. And the nerves become sensitive because they've been repeatedly compressed or torsioned by extra muscle work sustained over a long period of time, and also combinations of awkward angles sustained over periods of time. And in the severe cases that I've seen, and I've seen a lot of this over 30 years, there are some patients who just become hypersensitive to the task that aggravated them originally, whether it was keyboard use or playing a flute or piano or violin, and they've no choice but to give it up. Now that's the very extreme end of the spectrum. The vast majority of patients can be managed with some controlled exposure to the aggravating activity, systematic treatment to try to address all the tissues that are sensitive. But recognizing nerve sensitivity is really important, because sometimes there's no option but to use certain kinds of nerve medications, and Lyrica and Neurontin would be the two commonest ones, to try to get the nerve to settle if it's become hypersensitive. So that's important to recognize. An observation I've made is that I've rarely seen people with repetitive strain injury who habitually exercise. So it does seem that not exercising and not having reasonable muscle tone and flexibility is a big predisposing factor. But by the same token, I would also say that a lot of times folks who get this kind of a problem tend to be highly driven. They tend to be very hyper-focused and driven, trying to achieve or optimize better quality work or longer work, or achieve more skill and precision if it's playing an instrument and things. So they would put hours and hours and hours of practice in, and often don't particularly enjoy exercise. But that's sometimes a bit of a barrier that we have to cross, because once the system is broken down, it's really sort of telling us that there needs to be some structured changes as part of a management plan. But that's usually something that happens in the later stages of rehab rather than the early stages. It's an interesting topic, repetitive strain injury. Not a lot of clinicians specialize in managing it, but it does need to be recognized, and it does need to have a specific kind of treatment approach in order to get an effective result. And some cases can be very severe and resistant. So that just prompted a thought in my mind. I've seen a lot of it over the years, but hadn't seen a case in probably in 6 months or so. So that just prompted me just to share that experience with you. Hope you found it interesting. I'll see you again in another video. Bye for now.